when did you even get these done? Where was I?
You were in the gym.
And he was done before I came back?
Yeah, it was very simple. I went on the lab website, booked a slot, the lab technician came,
Hmm.
drew my blood, labeled them in vials, told me how long it's going to take for the results to come, gave me my patient ID, and yeah, that was about it.
There's also that consent form for HIV, no?
Yeah.
So basically, we have confidentiality laws that protect HIV patients. So when you do get this test done, you sign a form that allows the lab technician to inform a doctor of your HIV status. So if you do test positive, the clinic can then contact you with like the treatment and your medical options that lie ahead.
If I don't have someone like you in my life, I have to keep going to the doctor.
I mean, ideally, you should have a doctor who can help you out with all these little queries and just guide you along the way. But yeah, it helps to be able to read the tests on your own, especially because the language for every test changes a little bit.
Why? Do they have more rapper names like syphilis does?
I mean, at first glance, yeah, it looks like all of them are super complicated and everything has a different answer. But essentially, if you go to different labs, they're all giving you the same information. So, for example, if we're talking about herpes, right? If you get tested for herpes from two different labs, the report will discuss herpes in exactly the same way. Where it gets confusing though is that in your herpes test, there are two types where it will say herpes 1 and 2 for IgG and herpes 1 and 2 for IgM.
What's IgG and IgM now?
IgG and IgM are two types of antibodies, which are proteins produced by your immune system to fight infections. Now, immunoglobulin M or IgM is the first line of defense. It's the first antibody your immune system will produce when it notices an infection. It indicates a recent or an active infection but does not stay in your bloodstream for long. Now, IgG develops later after IgM and provides long-term immunity. It stays in your bloodstream for a very long time, often years. It indicates a previous exposure or a past infection or even immunity with the help of vaccines. Now, when you get the report, you often get a reactive or non-reactive value. इसका मतलब क्या है? IgM reactive means you currently have the infection or you currently have an active infection. IgG reactive means that you have been exposed to the infection previously in the past, or you may have developed immunity to it through vaccinations. Now, a non-reactive result means that the test didn't detect the antibody. For IgM, it means that you don't have a recent or an active infection. And for IgG, it means that you haven't been previously exposed to the infection or you don't have the immunity for it. Now, testing for IgG and IgM helps us doctors understand if you have a recent infection or a current infection, if you have been exposed to the infection in the past, or if you're immune to a certain disease. इसलिए जाओ, test कराओ.